A preliminary study says children born during the pandemic are developing motor and social skills more slowly than children born before the pandemic, regardless if they contracted COVID or not. As WTIU reports, child experts say developmental concerns are adding to an already stressed parent.
On the east side of Bloomington, Molly McDonald unfurls yoga mats and shows what a child development class with new and expecting parents looks like. Previously a research specialist in developmental psychology, she teaches courses that help parents interact with their infants. She says early days of parenthood are isolating under normal circumstances. Tacking on stress of navigating COVID-19 guidelines and access to healthcare could have had detrimental effects for parents and infants.
In most cases, they're going into a hospital that is filled with people who are ill with COVID-19. The scariest place to be is where they have to bring their baby into the world. So there were unbearable amounts of pressure on new parents.
She hopes the cocoon helps new parents access a community and decrease stress. Anna Branham had 2 children during the pandemic, one in 2019 and one in 2022. She attends and now teaches classes at the cocoon. She's worried about her children's safety and connection to the community.
I'm okay if they're known with a speech impediment or if it takes them 6 months longer to catch up developmentally, but I do want them to be healthy and to be known.
Because of the pandemic, Branham's children haven't had as much interaction with their grandparents or extended family as she wants.
We spent so much time in isolation where we couldn't see friends, we couldn't see family, and there's a lot of grief as a parent when you've spent 10 months creating this human and there's no one to share them with.
Because infants weren't meeting as many people, Professor of Early Childhood at IU, Mary Benson McMullen, says seeing some delays in development during COVID makes sense. She added facial expression is key for infants to pick up on emotional cues, and masks could have been an inhibitor. But she also says it's hard to tell how much effect a delay at 6 months will have long-term. The Columbia study reporting delays in development used feedback reports provided by mothers, which McMullen says might say more about the stress and anxiety new parents are facing. The National Library of Medicine reports increased symptoms of stress and anxiety among new parents since 2019.
So if your sense of security and safety is shaken, or you're preoccupied by that in terms of your mental capacity and your emotional capacity, your ability to care fully for your child or yourself might be impacted.
She says if parents are isolated and anxious about their parenting, they might be more likely to perceive their child's behavior as different or delayed. Her concern was a limitation mentioned in the study.
As they look at the benchmark tables of what your child should do at a certain time, not to become too concerned about their child missing a benchmark, missing a milestone.
Branham says attending and starting to teach classes at the cocoon has helped her work through what she went through as a parent during the pandemic.
I love holding space for women who are postpartum and letting them know that they're seen and that their baby is seen, since it's something that I didn't get.
She says parents might be grieving right now, whether that be through worry about their children's development or their baby missing out on moments of in-person love and normalcy. For Indiana News Desk, I'm WTIU.
McDonald says if people can access the cocoon in person, she runs the 3 Journeys online community for parents.